Chronic illness is any condition that is persistent or has long-lasting effects. Examples would be asthma, cystic fibrosis, Crohn's disease, or diabetes. So, as this is a new virus, we don't have a lot of evidence as to the impact of the virus on children. What we do know from other countries where there have been large number of people affected is that the virus doesn't seem to adversely affect children. So all children are at risk of picking up viruses. There is some evidence that this virus seems to be more transmissible than other viruses out there. However, in general, children with chronic conditions don't pick up more viruses than a child without chronic conditions. What the impact of it might be is that a child with a chronic illness could get sicker from the virus than a child who doesn't have a chronic illness. So we know from our experience with other viruses out there that children with certain chronic lung conditions and children who are immunosuppressed may be at risk of more severe illnesses from certain viruses. However, again, the anecdotal evidence would suggest that large numbers of children with or without chronic conditions are not being admitted to the ICU with this particular virus. However, we have to keep an open mind and watch for the evidence as it evolves. For the most part, during this crisis, the general advice is not to change your current medical management. Obviously, there are certain circumstances and certain situations where you may need to alter your medical management, and you obviously need to consult with your primary healthcare team, your pediatrician or your general practitioner if that's the case. But in general, pediatricians are not telling children to escalate or de-escalate their medical treatments because of this crisis. So far, we are not seeing large numbers of children with chronic conditions being admitted to our hospitals, so that is a very positive point. But again, we do need to remain vigilant, and it is possible that children could get sick from this virus. So everyone really needs to follow the HSE guidelines. There are certain children with chronic conditions who need to cocoon at this time, and you can go onto the HSE website and look up the advice for that. For other children who don't need to cocoon, probably the most important advice is social distancing and hand washing, as you've heard so many times already. But really, we need to keep a very close eye on this situation because the data is coming out every day and things are changing. But so far, children in general have good outcomes from this virus.
How a child reacts from a psychological point of view to the COVID-19 pandemic differs from child to child, and just because a child has a chronic illness doesn't mean that they're going to struggle more than a child without a chronic illness. However, we do know that children with chronic illnesses can be at more risk of experiencing increased stress and anxiety in general compared to their peers. So a child with a chronic illness may find that the COVID-19 pandemic adds to the stress and anxiety that they're already experiencing in relation to their chronic illness. However, there are certain things we can do to reduce or eliminate the stress or anxiety that children may feel in relation to the COVID-19 pandemic. First of all, we need to validate children's worries about the coronavirus. It's very important to listen to children's worries and that they feel listened to. We can have a tendency to dismiss children's worries by saying things like, "Don't worry about that," but children can't control what they worry about. Instead, we need to validate their worries by saying things like, "That must feel scary," or "That must make you feel sad." Then we can normalize their worries by saying things like, "I felt scared like that when," and then we can help them process their worries by saying things like, "Although we might feel worried, Here are all the reasons why we're actually quite safe. By doing this, we teach children how to process worries effectively. We also teach them that approaching parents about their worries can be supportive and beneficial. Another thing we can do to reduce children's stress and anxiety in relation to the COVID-19 pandemic is to help them express difficult emotions in creative ways. Children often express difficult emotions such as worry and fear through doing things like lashing out or becoming withdrawn. However, by encouraging them to express these emotions in creative ways, such as through drawing or through writing, we facilitate them to process these emotions more positively. So we can say things like, can you draw a picture of some of the things you're worried about? Or can you write a story about why someone might be worried about the coronavirus? When children express difficult emotions in creative ways, they feel relieved, and they return to these strategies when they feel these difficult emotions again. That's really important is for parents to talk to their children honestly and at a level they can understand about the coronavirus. Children are being bombarded with information about the coronavirus, and this can cause them some anxiety as they may have difficulty understanding some of the information and overestimate the risk to themselves and to their families. Parents should take time to find out what children have already heard from media and from other friends and correct any misconceptions they have. They should also check in regularly with children and address any new emerging fears or misconceptions.
Yes, feelings of stress and anxiety can spur us to be extra vigilant in terms of minding our illness and ourselves right now. But they can also paralyse us to the extent that we feel demotivated and give up. Adherence is a human problem, not a patient problem. All of us can put our hands up and acknowledge that there are aspects of our lifestyle that we have been more lax with since this lockdown began, such as exercise or diet. So putting routine back in place is a fundamental start point. Having CF or diabetes or Addison's disease, these children may not have school, but they know that their disease never takes a day off. So set the alarm, timetable in their routine, their school, nice activities, as well as their medication management routine and their therapies. But be kind to yourself. You are not expected to be a parent, a teacher, and a therapist. You're expected to be human. So ensure the timetable is a timetable that both you and your child is able for. Appealing to a young person's sense of civic duty can help remotivate the child with chronic illness. From a psychological perspective, we are more inclined to do things that benefit others rather than ourselves. So highlight to your child that in minding their medical routine, they keep themselves out of hospital, and that facilitates their doctors and nurses to give their attention to people with COVID-19 who need that help right now. So in times of crisis, doing something gives us a sense of purpose and remotivates us. Psychologically, we are more empowered if our actions serve a greater purpose.